right. Welcome, everyone. My name is Randy Davila. I'm the president of Hierophant Publishing, the publisher of this wonderful, wonderful new book, What's Missing from Medicine, from Dr. Saray Stancic, who joins us tonight. Saray, welcome. Thank you so much.
Thank you, Randy. It's a great pleasure to be with you tonight and to celebrate this book. I have to thank you for the opportunity that you presented to me back in, can you believe, May 2019? It's almost 2 years since we met, and you offered me this amazing journey. And it's really been one of the highlights of my life, really. And I have to tell you, when I went to Barnes and Noble and saw the book on the shelf and had my children see that, it was just a joyful moment. So thank you for that gift.
Oh, and I'm so proud to publish it. And folks, I know that you're here, you've ordered the book. I want to say something before we get started. I'm in the book. I'm the friend who started playing tennis in his early 40s, who still plays with his coach, who I played with this morning, and he beat me again today. He's 75, people. So Dr. Stancic and I talk about he eats healthy, he exercises, he does all the things that she's going to talk about tonight. So, but let's jump right in. Your story is so incredible. And I know there are a lot of people who haven't had a chance to read the book yet, who bought it based on our recommendation. Tell us about your unique entry into the lifestyle medicine solution.
Yeah, so I'm going to take you back 25 years, Randy. October 11th, 1995, forever embedded in my brain because it really changed the course of my life. And at the time, I was a 28-year-old, highly stressed medical resident. And on that night, I was on call at the hospital, and it was one of those really busy nights where the pager just doesn't stop ringing. I was literally running from the ICU to the ER back to the general ward. And it wasn't until sometime in the mid-morning hours, around 3 o'clock, that I finally found that opportunity to make it back to the on-call room to take a nap. And I remember feeling so deeply fatigued, something I had never experienced before. And so when I finally made it to the room, I just passed out. And that wasn't typical for me because I usually would get to the room and worry about the patient in the ER and worry, not that night. It was just something that I had that was just unique. Shortly thereafter, in the middle of that call, I was paged again. And then when I tried to get up out of that sleeping position, it happened. I couldn't feel my legs. And so just like that, everything changed. And next thing I knew, I was in the ER undergoing an MRI of my brain and spinal cord. And those studies confirmed a diagnosis of multiple sclerosis. So the shocking diagnosis at that very young age, my expectation, I had just completed my dream to be a physician, and I had plans, things that I wanted to achieve. And all of a sudden, the rug had been pulled out from under me, and now I was no longer that young, healthy woman that I thought I was. I was this chronic illness patient, and I knew what MS meant. And when the doctors reviewed the films with me, I quickly recognized there was a big burden of disease on those films. And regrettably, at that point in time, he said to me, "I need to be very forthcoming with you. You need to acknowledge the fact that you will likely be in a wheelchair within 10 to 20 years, and you need to plan for that."
Mm.
So, yeah, so that all happened in that 24-hour window. And so then what followed was a difficult period, hospitalization, and then over the next several years, recurrent exacerbations. I found myself at one point dependent on about a dozen medications. And within 8 years of that diagnosis, I was largely dependent on a cane or a set of crutches, a diaper, and a pill box in which I carried these medications wherever I went. So that was the difficult period. And then in 2003 came what I call my aha moment. And that's when I came across, by chance, literature that discussed the connection between diet and disease. And I was struck by this because here I was, a dual board certified physician, attending physician, and I knew little to nothing about diet and its effect on health outcomes. But
Your
that,
the blueberry moment,
yes,
right?
the very moment, the aha moment, yeah.
Yeah.
And that just triggered this, it was the catalyst that led to wanting to, delve into the literature and really understand these connections.
And I think that's important just to flesh this out, because we had a couple of questions and a couple of, and we're going to get to, I know several of you submitted questions. Thank you. We're going to get to as many as we can, but a couple of them centered around the importance of blueberries. And I think that in a part that you don't want to make the point that this isn't the blueberry diet. The
No,
blueberry aha moment for you was something different. Can you tell us about that?
yeah, for sure. So, I mean, because it's funny, absolutely right. It's not the blueberry that is the important part of the story, right? It was just that was the entry point. I read an article, a study that looked at MS patients and fed them a diet rich in blueberries. And the authors concluded that the patients who consumed this blueberry enriched diet felt a little bit better, that subjectively they had some improvement, and they attributed these improvements to the antioxidant capability of the berry. But of course that's not the end of the story. That was just the catalyst, and in fact that study was a poorly constructed unscientific study, so I didn't take it very seriously. But it acted as the catalyst. For the first time in my adult life as a practicing attending physician, I considered the following question: could there be a connection between diet and disease? And I think it's extraordinary that I was not aware of that, again, as a dual board certified attending physician. So that was the catalyst that then led to wanting to explore more. And that's when the first real legitimate publication that I came across was an article published in New England Journal of Medicine by Dr. Roy Swank. And believe it or not, that was published in 1952. We talk about it in the book. And at that point, Swank hypothesized that saturated fat was playing a role in the pathogenesis of multiple sclerosis. And not only did he hypothesize, he actually started treating patients with a low-fat plant-based diet in the 1950s, went on to follow about 140 patients over 34 years, which is striking, and ultimately concluded that his patients, 95% remained disability free. So when I read that, in 2003,
Yeah.
it was, wow.
Yeah.
I mean,
For me, that's one of the most important points you raise early in the book, is that this information is fact well tested. It's been around for 50 years, but you, as a dual board certified physician, had never heard this.
had
And by
never,
that time had been a patient for 8 years, which as you explain in the book, and tell us a little about that. I mean, that wasn't a fun time in your life, those
no,
first 8
absolutely not.
years.
It was a very difficult time. I mean, I was drowning. I mean, the medication that I was asked to start, and at the time in 1995, there was only one drug approved by the FDA. It was a drug called beta seron, and it was a drug that I would have to inject every day. And the side effect profile of this medication is extraordinary, including flu-like illness, injection site reactions, depression, suicidal thoughts. Um, and so this was something I had to do every day. And Randy, I mean, from just the injection site reactions, I looked like a spotted leopard, because these lesions and these painful lesions were all over my body. And I, at one point, ran out of real estate, and I didn't know what to do. I mean, it was just, and every night it was 10 o'clock inject, 2 o'clock I would awaken with the fever and the chills. And so you can imagine doing this every day, how it would greatly compromise one's quality of life. So of course I became depressed. Of course I lost hope. The fatigue that I suffered, the neuropathy, the pain from the disease itself, issues with my bladder. So at some point it was overwhelming. I had very little hope until I came across that moment in 2003 where I began to explore other possibilities, other modalities to serve to better manage my disease.
And as you recount in the book, and remember, there's a lot of people who are effectively meeting you for the first time here this evening. So I want to make sure that we get this background information because it's just so important. But, you know, at the time you, when you made the decision to start to move towards a plant-based diet, and that was not something that your current doctors, and you had access to the best. I mean, you were a physician that
Right.
were, they were not excited about your decision. And my, yeah.
No, not at all. That's saying it lightly. Yeah. No, they thought my decision to taper off of those medications was irresponsible. And they told me that I was going to increase the likelihood that I would have a bad outcome. But what they didn't understand was my day-to-day living, you know, what my quality of life was like. And I saw some hope here. And it wasn't just, by the way, diet. There were so many other aspects that I was reading about, like exercise. Believe it or not, in 1995, it was falsely believed that exercise exacerbated the disease. So I wasn't doing anything. I really couldn't do much. So I had to learn how to introduce physical activity into my life in a safe fashion. So the only thing I could do was to plop up on top of a stationary bike with my husband's assistance, and I could do very little at the start. I could maybe do a minute, and then I would be, you know, exhausted and in pain, and my husband would carry me off. And the following day again, but I was persistent about doing it every day. But yes, bottom line is that my physicians did not support the decision. And it wasn't a decision I made lightly, Randy. I really thought things through, and I read a lot of literature to help support my decisions. And so in 2003, I went ahead and decided that I would maximize or optimize every aspect of my lifestyle, not just my food, but also my exercise regimen, address those streams of stress that were coming into my life. I had to learn how to sleep. The, you know, of all the accomplishments, I think I'm proudest of that, because for so many years, I was such a poor sleeper. I would definitely define myself as someone living with insomnia. I was a very stressed out young lady. And you know, when I was first diagnosed, I was given prescriptions for hypnotics like Ambien or Xanax, and I happily accepted them because it gave me an opportunity to sort of put all of this pain and suffering aside for a short period of time. But guess what happened? When I woke up in the morning, all of my problems were still there. So I had to learn how to confront them, and I had to learn effective sleep physiology, understand what my environment should look like, understand what my behavior should be, my pre-sleep rituals. And as I introduced all of these modifications, I became this really good sleeper. And it didn't happen in a week, and it didn't happen in a month, but over time, I started to see that things were moving in the right direction, and there was excitement and positivity.
Yeah, and I want to get to sleep, but I don't want to get ahead because that's a further in down on the wheel. There was a couple of questions that came in specifically about making that transition to the plant-based diet and how difficult it is, as well as a specific question about what was it like those first, you know, when you were taking those first steps, or excuse me, on the bike pedals, and then progressing from walking to running. I mean, can you share a little more in-depth detail about how you did both of those two things, which I know weren't easy at the time?
Well, I can tell you that it was a journey. It didn't all happen overnight. I didn't go from eating a standard American diet, which is really what I was consuming, to the diet, for example, that I have today, which is pretty pristine. At first, it was just modifying and adding plants onto my plate. Like, what could I substitute? Because I knew that if I changed everything overnight, it would be unsustainable, that I needed to do this at a rate that was comfortable for me. So I would say that it's almost like every week I was going to add something and modify and continue to improve. The exercise was probably one of the hardest things I had to do, because it required a lot of, or rather I experienced a lot of pain in the beginning. And also I wasn't sure at the time if I was doing damage, because what would happen is I would exercise and then I would have that shower of pain, and it would take 10 to 15 minutes to recover. But what I learned after about a month or 6 weeks into it, that the period of time to recovery was shorter and shorter and shorter. And I started to build more and more stamina. So I could do, instead of a minute, I could do 2 or 3 minutes, and I can continue to capitalize on that. And I just felt better. I within 3 to 6 months of my lifestyle modification, I started to feel confident enough at times to leave the cane in the car, which was really a big moment for me.
Mm. Yeah, and so let's now talk about the progression from, because diet and exercise get all the press,
Yeah.
and so, and which are vital. I'm not downplaying that in any by any means, but there are four other, as you mention in the book, equally important components of lifestyle medicine. So how did you begin to move into those? Tell us what those are, and let's go through them, because I think that's what so many people, honestly, what I've seen, don't do. They
Right.
it's the
So
first.
we're talking about stress, sleep, substance abuse, and social connectedness. So stress was a big one for me. Again, as a medical resident, a fellow, worried about my boards, the work that I was committed to, caring for my patients. This was a stressful environment. So I needed to modify my perspective. How was I best going to manage that? And I turned to meditation and yoga and mindfulness. Mindfulness was a practice that was new to me, but it was something that really resonated with me and served me in such an important way. Something that I practice daily today. And again, it's been more than 15 years since I started my journey. So again, at first, it might have felt a little bit uncomfortable, a little bit unusual, but it was such an important addition to my daily lifestyle to help me better manage the stress in my life. The sleep we talked a little bit about already, but really learning how important the environment is, keeping it cool, dark, and quiet, understanding what behaviors I was engaging throughout the day that might affect my sleep. Like, was I consuming coffee late into the day? Was I exercising right before I went to bed? What was I staring at a screen before I went to bed? So understanding those connections and creating those modifications in my behavior led to sleeping effectively. Understanding that alcohol might have been something that I might have turned to take the edge off or to manage some of my stress, learning how it was going to affect my sleep cycle, and turning to alcohol to effectively address my stress was not a very good idea. And then finally, turning to others for support. I'll give you an example. At this point, I was chief of infectious diseases at the VA in New York. I turned to my team to let them know I wasn't going to take on that extra clinic time, or I wasn't going to take on that additional clinical study that I might have done previously. I learned how to say no. And for the first time in my life, I put myself first, which was something that was hard for me because I was always serving someone else.
That's what attracted me to this book so much, beyond the diet and exercise, is that the remaining 4 points are, I'm a self-help publisher, and
Yeah.
these are so critical. I think, when they talk about the stress, the emotional connection with relationships, these are things that lead to poor physical outcomes, as you so eloquently put in your book.
Right. I mean, I think that when we think about lifestyle, the majority of us are so focused on diet and exercise, and we pay little attention to these other aspects of lifestyle, but they're really, really important. And when we don't tend to them, we create that pro-inflammatory environment, remember, that feeds these chronic diseases. Because at the end of the day, um, what feeds the development of these chronic diseases, be it multiple sclerosis, coronary artery disease, diabetes, is the same thing. It's chronic inflammation, it's oxidative stress, it's overstimulation of the sympathetic nervous system, it's dysfunction of our immune system, dysbiosis in our microbiome. So these are all the catalyst that drives the expression of these chronic diseases. And when we engage in these anti-inflammatory behaviors, we create a healthy environment in the cellular milieu, and then we have good health outcomes.
Yes. And the other unique contribution that I see is your focus on the substance on other substances beyond just alcohol and drugs, as far as, supplements and other things that people will turn to. Tell us a little bit about that, because that is a unique aspect that you bring to this.
So this is the first time I've shared that that story, but around 2006, 2007, as I was really flourishing with my optimal lifestyle, I read a book that discussed further improving lifestyle by adding supplements. And I was very interested in what this physician had to say. So I read about it and I said, well, you know what? I feel so good right now. What if I were to add this additional aspect? Might it further improve how I feel? So I started taking these supplements. And what happened is within a few weeks, I wasn't feeling so well. I started to develop nausea. Again, fatigue. So I started to think, is my MS sort of rearing its ugly head? What I found a few weeks later, I ended up going to a friend of mine who's a physician who did some blood work, and my liver enzymes were sky high. It turned out that taking these supplements, I had developed something called drug-induced liver injury, and I ended up in the hospital for nearly 2 weeks. And it was quite a lesson for me. And it's something that I always talk to patients about, because so many patients who come to see me come in with a bag of supplements, and they tell me that they take these medications, or rather these supplements, because they feel it's going to make them that much better. But here's the thing: supplements do not undergo the rigors that, for example, a pharmaceutical agent does in terms of development. So we have to be very, very careful. And some of these supplements, claims are offered that are not scientifically supported. So the bottom line is that in order for us to live our optimal self and achieve our best health outcomes, it's really quite simple. It's about eating a diet that is rich in plants, and we talk about that in the book. It's about finding movement every day. It's about addressing our stress, about sleeping effectively, and taking a good, honest look at any substances that we use in our personal life, and being very honest about that. And then engaging in those connections with loved ones and family members and friends. That's so, so important that we continue. And in the midst of this pandemic, we've had challenges with maintaining those social connections because we've been so isolated. So it's really important now more than ever that if we can't be in the same room with our loved ones, that we're utilizing FaceTime or Zoom, that we have these connections and these interactions, because they're important not only for our personal health, but it's important to support our family members.
Yeah. And, that's what I hope that everyone hears. In a case that I think you make so clear in the book is that because of the overall changes and so many aspects of your life, that you got to be gentle with yourself. It's not going to happen overnight. It's a piecemeal approach. And when you fall, either literally or figuratively, pick yourself back up and don't beat yourself up. Don't say, oh, I'm, get back and start again and stick with it. And I mean, that's what I loved about the book.
Oh my gosh, such an important point. I mean, we're so tough on ourselves. We can be making really good decisions for a week, and then we make one bad decision, and then we're so angry at ourselves, and then we just set ourselves back. That has to end. And it's okay. You don't have to be perfect. And I always say when a mistake occurs, um, take it as a moment to learn from it. Take that obstacle or that challenge. And just the other day, I made a bad decision. I'll share with you. I ate really late in the evening, and I shouldn't have. I typically go to bed around 9 o'clock, and I was busy, and I ended up eating around 8 o'clock, which is a terrible. And I knew as I was doing it that it was the bad idea. Well, I wasn't able to sleep well. This was Saturday night. Again, it's a reminder. Next time I'll know better. Don't make that decision. We're going to make mistakes, but it's always a wonderful opportunity to learn from it. And so next time the same situation presents itself, we'll make a better decision. And
it's gains over long periods over the long haul.
exactly.
And especially in something that's for most of us such a magnitude of change. And in my own case, and you and I have discussed this, the sleep was the area that I personally needed a lot of help with. I for some reason in all my books and studies, I had overlooked the importance of a good sleep hygiene until
So important.
I met you, and would pride myself on, I only got this amount of sleep and I can get this done. And boy, your body really needs that for the
Body
recovery.
really needs it. And so many of us will say things, oh, I only need 5 hours. Because I'm really tough and I can do it. No, you don't. Everybody needs this. It's so important. It's during this time that we regenerate, we recuperate. We need this time to heal so that we're best suited the next day. And sleep to me is so very important. And as I said, to me, because for so many years I struggled with it, once I mastered it, it's been incredibly important for me.
Yes. Well, I want to get to some more of the specific questions here, and one of them, and folks, I thank you so much for sending these in. I'm for sake of some of them were really long, and I piecemealed out the question portion, and so Saray, just to give you the background, this was written by someone who had developed hepatitis symptoms and then was ultimately diagnosed with autoimmune hepatitis. And went to the Bernard Clinic and switched to plant-based and had a wonderful outcome. But this was after dealing with her regular physician and getting a lot of resistance, as you did. And so, and I know that you're passionate about some of the educational changes that need to take place. And so her question is, as patients, how can we help our physicians to look beyond standard medications to diet and other lifestyle factors, particularly with rare conditions for which there are few specialist physicians to choose from and little or no research on controlling or reversing the conditions with lifestyle changes? And she cites her autoimmune hepatitis as an example of that. So what's going on in the medical community, and what is your advice to these patients who, and honestly, in some cases sound like they know more than their the first doctor they see about it?
Well, that's a great question. And as you know, regrettably, in medical school, we're not learning this. So by no fault of their own, her physician, who I'm sure is well trained and isn't ignoring this on purpose. He or she just isn't trained on it, and that's part of my efforts and part of my passion is to bring awareness at the level of medical schools so that we create changing curricula. I think the good news is, Randy, that certainly we have seen movement in the right direction here. I can tell you, for example, that at the American College of Lifestyle Medicine conference, when I first attended, I would say about 10 years ago, there might have been 100 physicians in the room. Our last conference, I think we had more than 2,000. And at that conference, I was able to screen Code Blue, which was another amazing experience. There is more and more awareness. There are medical schools that are modifying and introducing lifestyle medicine into their curricula right now. And so I think the future looks very bright in that we will have what I call enlightened physicians that are practicing with this foundation of lifestyle medicine, because lifestyle medicine shouldn't in and of itself be a subspecialty. All physicians should have lifestyle medicine at the foundation of their practice, be it a cardiologist, an endocrinologist, or a gastroenterologist. These should all be principles that are readily practiced within their scope. I think that if you're a patient who's sort of struggling with a physician that just isn't aware, you might want to mention the American College of Lifestyle Medicine, maybe give them a copy of what's missing from medicine. Or you can go to the American College of Lifestyle Medicine and you can drop your zip code in there, and physicians that are board certified in lifestyle medicine, they're all over the country and they're becoming more and more commonplace. But I understand the individual who wrote the question. I'm glad that she or he visited the Barnard Center, because I know she got good care there.
Yes, yes, excellent. And you know, I we had a family physician that was you know, for years, who was such a good doctor. You know, when I was growing up, and I remember him diagnosing things and just so, and he was quite honestly overweight, and I smelled like cigarettes sometimes. And you know, so in other words, and this, remember, I'm, you know, 52, so but the you know, there was a time that
Randy,
yeah.
when I started medical school in the late 80s, you could smoke in the hospital.
Yeah, yeah. Wow.
Think about that. I say that to our medical students, and they say, "No way! Are you serious? You could smoke in the hospital?" Yeah, you could. It wasn't in 1964. The Surgeon General produced the report that outlined, based on supportive evidence from 7,000 studies, that smoking cigarettes was leading to cancer and heart disease and COPD. And despite that, it took us nearly 30 years to get smoking out of hospitals. Think about that. Today, the number one contributor to premature death is no longer smoking. It is now our diet, right?
Yes.
And we've talked about this. In my medical school in Newark, New Jersey, within the four walls of the cafeteria in this tertiary care center, there lies a Burger King restaurant. Does that make any sense to you?
No.
So we've replaced the cigarettes in the hospital with the fast food in the hospital, which is, again, contributing in the same way, leading to the obesity epidemic in which we live in today, the obesity epidemic, the chronic disease epidemic, which is, by the way, by no means plateauing. I've mentioned this to you when we started writing the book in 2019. As I gathered information, I went to the CDC website to see what the obesity rate was at the time. It was 39.8 in the summer of 2019. And then right before when we went through our last round of edits, I checked facts again. I went to the CDC to check the obesity rate. It was now 42.4%. So in 1 year, our obesity rate climbed by 2.4% in our country.
Which is an astounding number when you think of 330 million people.
Yeah.
And so let's, you know, you mentioned the pandemic a few minutes ago.
Yeah.
And of course you submitted this manuscript before COVID-19, and I asked you to write the preface and talk about that. And so it seems now more than ever, because the connection between these lifestyle changes and what a disease like COVID-19 or some other one can do to people.
Right. So we've learned, and there was a publication in June of this past year. The CDC produced some preliminary data through the morbidity and mortality report, and shared with us that if you had a chronic disease at the time that you were infected with SARS-CoV-2, the virus that causes COVID-19, that you were 6 times more likely to be hospitalized and 12 times more likely to die. So think about that. More than half of Americans are living with at least one chronic disease. So we are a country that is poorly equipped to battle this acute infectious contagion, right? And I hope, and we talked about this in the book, that this very difficult period that we've experienced over the past year, And it's been a year. It was in January, I think January 16th, where the first case of COVID-19 in 2020 presented. So it's been a little more than a year. That the silver lining here from all of this pain and suffering, morbidity and mortality, that it serves as an awakening that we need to change our habits as Americans. And of course, I'm speaking to the our habits here in our country, but this is a global matter. This idea that so much of what we're dealing with today, so much of the chronic diseases that we're seeing today are largely preventable. The evidence speaks to this clearly. 80% of chronic diseases can be prevented by modifying our behaviors. Heart disease, the #1 cause of death in our country. We lose more than 600,000 Americans each year from heart disease. We have the knowledge and understanding today, Randy, to prevent 80% of those deaths. And we must, as physicians and healthcare professionals, speak to this loudly, effectively, because our communities need to hear these messages.
Yes. And we had a related question, and I think your background as an infectious disease specialist makes you unique to answer this particular question related from someone who's 75 who says, I'm doing lifestyle medicine, I'm feeling very healthy. How do you feel about me getting the vaccine? Would you have any concern with that, et cetera?
Well, no, I would highly recommend the vaccine. I mean,
Yeah.
of course, I think it's important that putting aside lifestyle medicine for a moment, practicing effective infection control measures are incredibly important, and everyone knows what they are. You don't need me to say it. I mean, maybe you do. Wear your mask, maintain 6 feet, wash your hands, be mindful of all of that. But the idea that if you don't meet any exclusion criteria for the vaccine, and if this gentleman is 75 years old, he would be at a high risk, in a high risk population. This is an individual that will likely benefit from vaccination, right? And I've also heard people say things like, well, I have a really great diet and I have an extraordinary lifestyle, so I don't have to worry about COVID-19. Well, that's not true either. We have to be very, very, very smart. Remember, the facts that I just relate to you about having a chronic disease, 6 times more likely to be hospitalized or 12 times more likely to die. That doesn't mean that if you're in great shape or you're eating a healthy diet, that you're at no risk of developing severe coronary COVID disease. So it's important for us to be aware that we still have to practice healthy infection control measures.
Yes, thank you for making that point. I wanted to also go back to the supplements for a moment, because we did have a question come in from someone who says that other than a calcium, magnesium, and zinc supplement and a higher vitamin D plus weight-bearing exercises, what can we do for the osteoporosis that many of us have ended up with, either from meds or for other reasons?
Well, there are medications that one can utilize for osteoporosis, but all of the measures that were described there, exercise, weight bearing, an optimal diet, all of those things are important. But if you have osteoporosis and you have advanced disease, then there may be a role for medication, and that should be something you discuss with your physician. Again, it's important. I just want to make this point. The book is entitled What's Missing from Medicine, because we want to speak to that all-important aspect that regrettably is often muted in the practice of medicine. When we go to medical school, Randy, our education is focused on this aspect of what we call pathogenesis. We learn how to become really good disease detectives. We understand the disease process. In fact, the way I describe it to my students is when you're going through the process, we learn how to collect clues, right? As these disease detectives, we take a good history, a physical exam, we draw blood, we do imaging studies, all in an effort to collect clues to ultimately make a diagnosis And then once we have that diagnosis, we create a treatment plan. And that treatment plan is typically a pharmaceutical agent, a prescription of some sort, a surgical intervention or a procedure. All of that is very, very important and should be part of the medical school experience. The problem is that we miss the mirror image of that. What is missing from medicine is what we call salutogenesis, which is the opposite of pathogenesis. Salutogenesis is the study of health and well-being. How do we maintain health and well-being? We don't learn that in medical school, right? Medical school is all about the disease state. We don't learn anything about the health state. So as physicians practicing medicine, we know how to treat you when you get sick, but we have no idea how to advise you on maintaining health. So that's what the focus of this book is, but not just on the other side of this. It's really important that folks understand that medications have a role and they're an important part of practicing medicine. I mean, I'm an infectious disease physician. Where would we be without antivirals and antibiotics that have made such a significant difference? Remember, I pursued the field of infectious diseases because as a young medical student and resident, I witnessed the HIV/AIDS epidemic. We had 2 wards of AIDS patients at University Hospital in Newark, and they were dying every day. We had little to nothing for them. We could just manage their opportunistic infections, but we couldn't treat the HIV itself. In the span of my career, it is remarkable that we've developed this armamentarium of antiretrovirals, and we've taken HIV/AIDS from a death sentence to a chronic disease that we can largely manage. And that's an extraordinary accomplishment in modern medicine and something that I am very proud to have been part of. Hepatitis, the same thing, a disease that at one point, when I was a young attending, Randy, cure rates were about 6%. They're about 90% now. And I'm proud of my contribution to that field. So medicine, pharmaceuticals are an important part of the healthcare arena. But this aspect that we're missing, these all important core principles of health are missed, and they're an extraordinarily powerful intervention. And that's really what I want to focus on, is on relaying that to the general public and to my peers in the field of medicine. We have to speak to this because it's so important, and it can change. It has the power to change an individual's quality of life. And I say this in the book, and I say it all the time. My hope for each and every one of us is to age gracefully, happily, joyfully. Each one of us live to our potential. And then on that last day, you spend an amazing day with your family and friends, clear of mind, enjoying a plate full of plants. And then you go to bed with a big smile on your face and you pass peacefully. That's what we want, not what we see today, regrettably, in our country, that bookend of suffering, where we're in a nursing home, demented, status post-stroke, developing one infection after another. And that's what I saw as an infectious disease physician. My last stop at the end of the day was the nursing home. And I would see these patients with infected decubiti, Foley catheters, demented, and that's suffering. And we know how to prevent that from happening. That's what we need to convey to our communities.
Thank you for that message. I mean, and that's, I think, so important and what I love about lifestyle medicine is it isn't anti the medical community. It embraces and welcomes and praises all the wonderful accomplishments and simply says, but you forgot this in the process. And this is critical. And I think your nursing home story there, so many of those cases are the result of poor choices that could have been prevented had education been had they known and made the right choices at the time.
Absolutely. I mean, I've had patients say to me, Dr. Stancic, patients who status post amputation from living with diabetes or status post heart attack, they have said to me, I did not understand these connections between what I was eating and what's happened to me today. I did not understand that all of these behaviors, all of these decisions that I made throughout my 20s, 30s, 40s, 50s affected my outcomes later in life. I mean,
Mhm.
here, an example, an important example is breast cancer, right? So breast cancer, we know the risk is largely affected by lifestyle behavior, right? What if we were to educate women or even girls early on, elementary school, high school, relaying these messages, how important it is that their lifestyle choices play a role in whether or not they develop breast cancer, whether they're 40 or 50. These are important messages, but we miss them. In October, we have Breast Cancer Awareness Month, and we wear pink, and football players wear pink, and there's a lot of attention. There's many organizations that raise money with walks like Avon or Susan G. Komen. And what do they talk about during that time? They talk about early detection, mammography, which of course is important, but we're missing an opportunity to convey this idea of primary prevention. Let's empower our young women to understand it's so important that they engage in daily physical activity, that they eat, you know, a diet that is rich in fiber and colorful plants, because it is equipping them to take control of their personal health so that they do not end up developing these chronic diseases later in life. And the other wonderful thing about the lifestyle medicine prescription, Randy, is that maybe for me, I decided to implement these changes in my life because of my diagnosis of multiple sclerosis. But the beautiful thing is that I'm also reducing my risk of Alzheimer's disease. I'm reducing my risk of diabetes. I'm reducing my risk of breast cancer. That's the wonderful thing about this prescription, is that it is all encompassing, and it's incredibly powerful. Nobody wants to believe it's this simple, that this very complicated problem that we've found ourselves in, this chronic disease epidemic, that the solution could be so simple. It is this
Yeah.
simple.
And of course, as the old saying goes, simple is not always easy, especially when making changes after 50 years of doing it another way. And so that's why the reminder to be gentle with yourself, get back on the horse, stay, stay on the path, and you'll get there.
Just
And
start with one small thing. I mean, just add, what could you do? Just add one piece of fruit a day. Could you do that? That's not so hard. We can do that. Could you go for a 10-minute walk? You don't have to do a 30-minute walk tomorrow. You could do a 10-minute walk. Just start with small goals and then build on them. It's
yes,
powerful.
excellent. A question came in about, and I know you talk about genetics in the book, and this one was specific to the question of her mother has MS and how susceptible would she be in any hereditary evidence that you know of on that. But I wanted to ask you about genetics in general, because there's always well, I have these things because it's genetic,
Yeah.
uh, and so
Yeah.
you
So
talk
we
about it in the book, but please, yeah.
Yeah,
Yeah.
so we placed it, and in my generation in medical school, there's always been a lot of emphasis placed on genetics, right? So my father had diabetes, his father had diabetes, so I'm going to develop diabetes, though. But it's really not our genes, right? We're all engaged in the same behavior. We're all doing the same thing. So it just takes that one individual to break the chain and decide I'm gonna go about life a little bit differently. Um, Genes, of course, do play a role, but they're not the end all be all. And when we look at, and we talk about this in the book, in autoimmunity, remember back when my doctor uh, first talked to me, or when we had the discussion about diet and lifestyle, the first thing he said to me is, this has nothing to do with your diet or lifestyle. This is your genes. And you can't do anything about that. This is your genetic predisposition. You have MS because your genes are telling us that you have MS, and you can't change that. But of course, we've learned, the science of epigenetics tells us that gene expression is dependent on outside variables, right? So just because you have a gene that puts you at risk of developing something doesn't necessarily mean that it will be expressed. That's the difference between genotype and phenotype. So epigenetics tells us that these outside variables that play a role in either turning these genes on or off are things like diet, exercise, stress, sleep, the lifestyle medicine wheel, right? So that all of a sudden it empowers us because we now have control of that light switch, that gene light switch. We can turn them on or we can turn them off. So genes play a role, but don't let anyone convince you otherwise. Lifestyle matters most.
Thank you. Another question that's specific, and of course you were in practice for many years, but have you seen any patients with TN? I'm going to hope to pronounce this correctly. Trigeminal
Neuralgia?
Yes, resolved through lifestyle medicine. Did you, as a doctor treating lifestyle patients, did you have anyone with that? She's also wanted to add that she's been an MS patient since 1995, who was recently diagnosed with TN and who is following the Esalen whole food plant-based diet.
Yeah. Well, I can't think of specifically someone who came to see me with trigeminal neuralgia and then we managed that with lifestyle. But I would say this, that as I said before, lifestyle medicine and the approaches that we talk about here are all encompassing and they will serve anyone for any condition. So do we have a clinical study that has treated X number of trigeminal neuralgia patients and I could speak to? No. But I think that if she's living with multiple sclerosis, and again, just because we're optimizing every aspect of lifestyle doesn't mean that she might not have a conversation with her MS specialist and consider a disease modifying therapy. Again, it's not this or that. Lifestyle medicine should be part of managing any patient, and then disease modifying therapies could be added on. So that might be a discussion she might want to have with her physician.
Thank you. So, and one final question, and I'm sure that you've have been asked this before, but as you know, there are many in your field that are very strict on the whole foods plant-based diet. And you yourself are vegan, and you say in the book that you hope that everyone would want to adopt that. At the same time, and the wonderful blogger at Food Politics, said what was different about you was that you say, if you're going to have a steak, then how can you make that a small portion versus a large? And so what do you say to those folks that are critical of your allowance of such things in lifestyle?
Well, I mean, I'm not one of those strict follower. I don't speak that way, and the reason I don't is because the evidence in the literature doesn't offer that. In regards to, you don't have to be a strict vegan, you don't have to be perfect. I mean, what we want is to increase the amount of fiber on your plate, right? I personally have moved to a diet that is animal free just simply because I just don't find animal foods very interesting anymore. And I feel really well. This idea of a whole food plant-based diet has allowed me to achieve an ideal body weight. I feel healthiest and happiest consuming this way. And again, as a physician, my recommendation when it comes to diet is really based on the many clinical studies that we have. And most of the clinical studies that we have are really not 100% plant-based. They're primarily plant-based, like the studies that we describe in the book. Like the diabetes prevention program is a great example of a study that looked at patients who were at risk of developing diabetes, and they randomized them to either diet and exercise or a medication called metformin. And this study showed that if you engaged in diet and exercise, you reduce your risk of diabetes by 2 times more effectively than metformin did. But in that study, it wasn't a fully plant-based vegan diet. It was a primarily plant-based diet, right? Mm-hmm. So I always want to speak to the objective evidence and not introduce my subjective thoughts when it comes to advising patients.
And that's one of the things I love about you. There are many, but one of the things I love about you is that you you put your own ego aside and say, show me the evidence. And let's stay focused on the evidence, and you know, and if the evidence shows something else later, then I'm sure you would.
And that's what I'll relay to the patient. And that's my responsibility as a physician, is to be objective and to present the data honestly and openly with the patient, and then they can make decisions. But there is no study to date that says you must be 100% plant-based in order to gain benefit here.
Yeah. Well, you know, in conclusion, can you tell us a little bit about Finland and what happened there, and their changes? Just because let's end this on some hope. This can be done, not just individually, but collectively, right?
Yeah, right. So North Karelia, Finland is like one of my favorite stories. It's a public health, it's an extraordinary accomplishment. So in the 1960s, it had one of the highest rates of heart disease in the world. And they brought together a small group of really ingenious individuals that created this public health plan. They were going to go out into the community and educate as many as possible. They knew that this chronic coronary artery disease was largely being fueled by post-World War II smoking habits, a diet that was rich in saturated fat, lots of dairy, lots of pork, very little fiber in the diet, a community that was growing largely sedentary. So they knew that these lifestyle behaviors were incredibly important. So they wanted to disseminate this information into the public. And so they taught and educated individuals, and then they went out into their communities. Like, for example, a housewife would have a gathering of 15 friends, and she would prepare healthier food options, and she would talk about the importance of plant-based nutrition or the importance of smoking cessation. So it was just like a soldiers going out into the field.
Effort. Yeah, a concerted effort.
Yeah. Like, here's what an example that I thought was so cool. There's a sausage that they would consume, which is part of their culture. What they did was, and when they stuffed these sausages, they stuffed it with some mushrooms. They replaced some of the
pork with mushrooms.
With mushrooms, and people didn't even really notice it, and they enjoyed it. Or, you know, they only grew berries in the summer and the spring, and so the federal government gave farmers incentives to grow more berries, and then they would freeze them, and so they would be available in the winter months. And all of a sudden, dietary change came. Smoking cessation. People became aware of the effects of long-term smoking, and smoking rates declined. And they went from the highest rates in the 1960s to a decline of more than 70%.
Wow.
Yeah, so it's an amazing story, and it tells you the power of education, public health, and community and sharing. We can do this.
We can do it. We can do it. Yes. That's one of my favorite stories in the book. So thank you for sharing that. And listen, I know it's a little later over there. You already mentioned your bedtime is 9, and it's almost that now. And thanks for taking this time. Thanks for writing this wonderful book. Folks, thanks so much for joining us. Please tell your friends about this book and other books. And this is we're passionate about the lifestyle medicine movement. So there are lots of great resources out there to take advantage of. Please do so. And thank you again, Dr. Stancic.
Thank you so much, Randy.
All right. Good night, everyone.